Hello, everyone, and welcome to another episode of the SCHA-MI podcast. Today, we're pleased and honored to have with us four-term U.S. Senator from Michigan, Senator Debbie Stabenow. Senator Stabenow also serves as the chairwoman of the U.S. Senate Finance Committee Healthcare Subcommittee. She's been a longtime advocate for school-based healthcare and will soon be introducing legislation to secure significant financial and technical support for school-based and school-linked health centers across the country moving forward. Senator, thank you again for joining us.
Well, it's really wonderful to be with you, to first and foremost say thank you to everybody who's doing such wonderful and important work.
Absolutely, thank you. I know it's going to be very exciting for our audience and our network around the state, and hopefully folks around the country who are watching to get to hear from you, such a prominent figure and an advocate for what they're doing. So I know they appreciate it, especially during the pandemic.
Yeah. It's my pleasure. So it's, I have to tell you, Eric, that actually my personal interest actually goes back farther than being in the U.S. Senate or being in elected office. I have a master's degree in social work. And when I was going through to get my degree, I did my work experience in the Lansing Public Schools, and then afterwards was hired to work at the time as a school social worker, as somebody who was, this is like the old days back in the 70s, where we actually had two school buildings that I went back and forth to, talked with young people, with students, did some home visits and so on. But I saw up close and personal how incredibly important it was to have health services, including mental health services at the school. And I had more than one occasion at that time, mid-70s, where I was actually sitting in the clinic with a student who was high on something and had to help them and sort of protect them and be able to work through that and so on, and deal with the substance abuse issues at that time, but also a whole range of other issues for children that they were finding, whether it was violence in the home or whether it was just a wide variety of issues. So I have a great deal of personal interest in this.
Absolutely. Yeah, for those of you who don't know, actually, Ingham County, where Senator Debbie Stabenow started her political career, not just being that it's got Capitol Hill in it with Lansing, was kind of the epicenter for the beginning of the healthcare network, or the health center network in the state. So I'm sure you were there, pretty much on the ground floor at that point.
Absolutely, and have just loved the way the networks have come together, the passion that everybody has. And we know that, school is one of the few places, maybe the only place that we have children, a large part of the day, where we can not only provide support for them in terms of an education, but have the opportunity for them to be able to have their healthcare needs met, mental health care needs met, where we can check in and see how they're doing and work with them and their families and so on. And so, and frankly, when we did the Affordable Care Act, as a member of the Finance Committee, one of the areas that I focused on was authorizing funding for school-based health clinics, because it is such an important place when we're talking about how do we reach children, how do we connect with them, how do we find a way to deliver healthcare, behavioral health services, and schools are a really important place.
Absolutely. Yeah, we always say our motto at SCHA-MI is healthy kids learn better. We're always trying to impress upon people, the correlation between kids' well-being and their performance in school. So obviously you've seen that firsthand, that,
absolutely,
able to get to them and provide them with that care, that they flourish, academically.
Absolutely. When you think about it, it's really important that children are not trying to learn on an empty stomach, right? And it's also important that they are learning and not in a situation where they don't feel well physically, or mentally or have some other issue, frankly, that relates to what's happening at home. And the eyes and ears of those involved in the school-based health clinic is very, very important.
Absolutely. And that leads me to a question then that it's a little bit more timely. As we've been dealing with the pandemic and COVID-19 and the quarantine restrictions, some school districts are shut down completely, and that affects their school-based health centers. Some, if they're remote learning, are still able to be open, the centers. From you and your colleagues, what is that level of concern about, maybe not specifically through health centers, but how we're maintaining support for these kids, when they're not at school 8 hours a day, when, like you said, it's our best opportunity, to provide support for them. What's been that concern for you on your end?
Well, this is a big concern for me, and I know for all of you. And whether we're talking about the fact that children, for many, many children, the only healthy meals they have are during the school day. So what happens when the food's not available? And so, I chair the Agriculture, Nutrition, and Forestry Committee, and we oversee all of the school meals availability as well as food assistance for family and so on. But, how do we make sure that is available for children? How do we make sure that their other healthcare needs are met, or mental health care needs? We know children have not been going to dental appointments, have not been going to doctor's appointments, have not been able to the routine kinds of things that they need to do. And somebody at a school-based health center, can really help make sure that children are having their basic needs met. And now under COVID as well, I mean, it's wonderful to see where we have active school-based health centers where folks are involved in dealing with the COVID testing and vaccines, and being that infrastructure in the school and in the community to be able to connect with parents and with children. It's such an important connection, and that's really what it is. How do we make sure that kids have the help and support they need? How do we make sure that parents do? How do we make sure they have the resources and are connected to the resources that they need, and then are able to benefit as a result of it?
Absolutely, yeah. So I guess that leads me into my next question then. You have some upcoming legislation that you're going to be introducing here shortly that's going to, again, provide support for school-based health centers. Do you want to tell us a little bit about that? What really, prompted you wanting to spearhead that effort, especially, given the current circumstances that all these centers are facing, like we just talked about with the pandemic? Tell us more about what prompted you to want to, champion that.
Well, we need to fund these efforts. And so, as the person who originally put the school-based health centers into the Affordable Care Act, and we never have gotten the full, the funding that we need. And so at the end of the year, we reauthorized the existence of the centers, but we need the resources. And so I've reached out to Senator Capito, who from West Virginia, my Republican colleague, who's also very interested in this. And so we have a bipartisan bill that would actually provide $200 million in funding for the SBHCs that we authorized at the end of the year, and it would also provide $50 million in funding specifically for expanded behavioral health care, which is so very important. And then the final thing, we want to create demonstration programs to increase and establish telehealth, which, as we know, has become so very important in the pandemic and in so many ways, being able to access high-speed internet, but telehealth services at our centers. And then we also want to allow federally qualified health centers to fully participate in the funding of these programs. So we've got the FQHCs, partnering with the school-based centers, and more opportunities for telehealth and more resources. I mean, need to have the school-based health centers be viewed as a permanent part and a very important part of providing resources and services to children in school. And my goal is to make that a permanent part of what we're doing for healthcare, including behavioral health for young people.
Absolutely. That's amazing, Senator. And obviously, us at SCHA-MI and in the network, we thank you so much for the work you're doing. It's truly incredible, and it's something that will impact a lot of lives, as we obviously know. We've talked a lot about how this impacts the students. What benefit then do you feel that this gives to their parents, and then folks who don't have kids that are in school right now? What's the benefit to them for their local school district to have a health center?
Well, first of all, we all benefit for the same reason that we all benefit from having high quality public schools where children can come out not only educated, but to be the kind of citizens we want them all to be. We all benefit from that. That's been one of the foundations in America, is public schools. And part of that, part of the reason we should all care, part of the reason certainly I know parents care, is to make sure that we are supporting the entire child, that we're supporting their healthcare needs, their mental health needs, so that they can be as successful as possible, so that they can be focused as they are learning, so they're not worried about a growling stomach or a headache or some other kind of more serious stress or some pain that is happening that needs to be addressed. So we want children to have every opportunity to be able to succeed. And that's something that all of us should care about, because that means we're going to be better. We're going to be better as a community, as a country, if these young people are healthy and able to focus on learning and be able to get the skills they need so that they can go on and help our country move forward.
Absolutely. And so how could these local communities, these health centers across the network in Michigan and across the country, how can they help support you and your coworkers in the Senate? How can they help you support this legislation to get it passed?
Well, we are very soon going to be introducing this, and once we get a bill number on it, we need all of you to reach out and be communicating with your senators, with your House members. Tell your stories. It's not about numbers. It really is about what you see in terms of children's needs, stories about how you've been able to help, or what you could do if you had the resources to be able to help, how the pandemic has made this even more complicated and worse, and how we need to be able to make sure children can come out of this successfully. I mean, we, in so many ways through this pandemic, it's the lost year, right? For everybody, for our kids, we can't afford for them to have a lost year or to be pushed back mentally or physically and so on, and not be able to recover from that. And so we need stories, we need outreach, we need emails and phone calls, and basically folks saying, this is really important. This is really important when we're talking about what do we need to do next in order to be able to support children to be successful, in order to be able to allow families to be successful coming out of this pandemic, that funding for school-based health centers is critically important.
Absolutely. That's the last question I had for you, Senator. Is there any last point you want to impress upon the network and the folks who are listening?
Well, I just want to say thank you again. I mean, the work you do is really, really important, and you need more support. You need more help. And, I'm hopeful that help will be on the way, because our children need it, and I'm grateful for all you do.
Absolutely. Thank you again so much for joining us, Senator Stabenow. We really appreciate all you're doing for the network across the country, school-based health centers, and the student patients who are benefiting from them. So thank you again.